Hello, my name is Luca Micci, and I'm a postdoc in the laboratory of Mirko Paiartini at Emory University. And the title of my talk is Determinants of Viral Control Following ART-interruption in SIV-infected rhesus macaques. As we know, ART does not eradicate HIV, and the virus rebounds upon ART-interruption in the majority of the cases, even after prolonged viral suppression and low viral burden. So this is thought to be the case of a source of viral reservoir with the most been studied resting memory CD4 T cells. So, however, a small cohort of 20 patients have shown a prolonged viral control after cessation of ART, with a median time of remission of 9.3 years. And therapy in these 20 cases was started early, within 10 weeks following primary infection, and maintained for at least 3 years. The estimated frequency of this post-treatment controller, PTC, was about 5 to 15% among HIV-infected subjects that have started therapy within 10 weeks following primary infection and have been treated for at least more than 1 year. So our lab has conducted many in vivo studies in SIV-infected ART-treated rhesus macaque. And among these, here I'm showing a retrospective analysis in 14 rhesus macaques, all female, BO8 and BO17 negative, infected with CMAC239 IV, and treated with 5 drugs regimen at week 8 post-infection. This ART was maintained for 7 months and then stopped, and we followed this animal for another 8 months after ART interruption. So interestingly, we saw that some of these animals control viral replication, and as such, we want to determine virological and immunological parameters associated with viral control after ART interruption to inform new therapeutic strategy for HIV remission. So I would like to point out the strength of this animal model that give us the opportunity to collect sample and data at pre-infection, at pre-ART, on ART, and after ART interruption. So here I'm showing the viral load data in the studied animals and after cessation of fully suppressed antiretroviral treatment. And as you can see here in these 9 animals indicated in black, non-controllers, they show the classical viral rebound that we have seen many times in macaques and also in humans. However, in these 5 animals called PTC, rhesus PTC, post-treatment controllers, they show a better control of viral replication for the 8 months follow-up with less than 10 to the third or equal to 10 to the third copies per ml, and in the last 2 months with less than 200 copies per ml. So the control was partial. We had just one undetectable rhesus. However, was really effective, and the log difference of viral load between non-controllers and the PTC was higher than 3 log. So the same scenario was seen when we measure cell-associated SIV RNA. As you can see in both groups, you can see a reduction in the RNA level during ART, and just in the PTC, you can see a better cannula-like control after ART interruption. However, in the non-controllers, the cell-associated cVRNA rebound with a level similar to pre-ART initiation. So we then wanted to further understand the factor regulating the control of viremia, and we assessed the pre-ART exposure. As you can see in the graph, PTC demonstrated lower peak and set point viral load when compared to the non-controllers. PTC here are depicted in red and non-controllers in black. And this corresponded to lower frequency of cell-associated SIV DNA in isolated CD4 T cells at the pre-ART initiation, and to further characterize the distribution of the viral burden among the different CD4 T cell subsets with fact-sorted TFH, naive, effector, and central memory in PBNC and lymph node cells, And then, in collaboration with Nicolas Chamont and Rémi Formentien, we analyze the cfDNA content in all these CD4 T cell subsets in both tissue, and we saw that PTC show a lower frequency of cDNA for all the different CD4 T cell subsets in both tissue. So we then want to look at the immunological feature of CD4 T cell subset prior to ART initiation, and we saw that Rhesus PTC had a higher number of circulating CD4 T cells, lower level of immunoactivation when measured by HLA-DR CD38 in CD4 memory T cells in the periphery, and higher levels of TH17 cells. So I want to just point out that TH17 cells were depleted in the mucosa. As you can see, here is the pre-infection and here is the pre-ART initiation. So you can see a decrease in the frequency of TH17 cells in the mucosa in both in non-controllers and the PTC. However, the PTC had higher level of these cells. So we then wanted to look during ART treatment, and we found that the PTC show a faster and more effective control of residual plasma viremia when measured by an ultrasensitive assay performed by Jeff Lipson from NCI. And as you can see here at day 200, the latest time point on ART, PTC, all the 5 PTC show a plasma viral load copy lower than 3 copy per ml, when the non-controllers show higher levels. So this corresponds with the lower content of cfDNA in isolated CD4 T cells at day 200, the latest time point on ART. And we found also a lower level of immunoactivation in CD4 T cells in the periphery measured by HLA-DR CD38. So we then performed the quantitative viral outgrowth by co-culturing insulated lymphoid CD4 T cells and the CMX174 cell line. So, and then, using limited dilution and multiple replicates, we estimate the frequency of latent CD4 T cells in the lymph node. As you can see here in the representative plot, here I'm showing CD4 versus P27 GAG. And as you can see here, for example, that's just a representative staining, but you can see the frequency of the GAG-positive cells in this co-culture was much higher than what we have seen for the PTC rhesus. So here I'm showing all the data for just 5 animals in the non-controllers and the 5 animals in the PTC, so that we had 9 animals non-controller. However, we didn't have enough cells to perform the quantitative viral outgrowth, but as you can see, the frequency of latent infected cells was much higher in the non-controllers when compared to the PTC. So recent publications have shown that CD4 positive, PD1 positive CD4 T cells and also including TFH represent the main reservoir of HIV infection. Here I'm showing the expression level measured by flow cytometry of CD4's PD1 positive and proliferating TFH. As you can see in both parameters, PTC show a lower frequency of these markers when compared to the non-controllers, and more interesting, we found a positive correlation with the frequency of latent CD4 T cells. Those consistent with the idea that these cells are important contributors to viral persistence. So we then look after ART interruption, and here I'm showing cfDNA data on isolated CD4 T cells at the pre-ART, 2 time point on ART, 1 early and 1 late, and 2 time point after ART interruption. As you can see, ART reduced the cfDNA content. However, after ART interruption, just the non-controller rebound with the amount of cfDNA increase almost with the same level seen at the pre-ART initiation, while the PTC remain stable, the cfDNA content, or continue to decrease, even in absence of ART. So the same scenario was observed in the cell-associated cfDNA in the GI tract, reduce DNA content on ART, and control of DNA content after ART interruption just in the PTC, but not in the non-controllers that rebounded. So I want to point out these that is really important for this model, so that this partial control of SIV replication was really beneficial for the host in immunological point of view, since, like after ART-interruption, this PTC shown a higher frequency of CD4 T cells and number of CD4 T cells and reduce immune activation. So we then perform a univariate linear regression analysis at the pre-ART and on-ART to identify parameters associated with an increased probability of PTC phenotype. And we found that the increased likelihood of PTC phenotype was associated with parameters such as decreased HLA-DR and CD38 level in T cells, decreased plasma viral load at the pre-ART, and especially decreased cell-associated cfDNA content in blood CD4 T cells. So indeed, a 0.5 reduction at both time point, pre-ART and on-ART, is highly associated with the PTC status. Those consistent with the data found from the SPARK trial, while the total HIV DNA was the best correlates of timing of rebound. So, and then among the CD4 subset that we sorted and then measured the cfDNA pre-ART, just the central memory in blood and the TFH in the lymph node was statistically associated with the PTC phenotype, thus highlighting the role of these cells in the HIV reservoir. So to conclude, some rhesus macaque treated early after infection can partially control viral rebound after discontinuation of ART. Key feature of PTC include a less progressive SIV infection with reduced viremia, higher CD4 T cells count, a low level of T cells activation, lower cDNA level in CD4 T cells at pre, during, and post-ART, more effective control of residual plasma viremia, and reduced frequency of latent infected cells in the lymph node during ART. So this partial control of viremia results in a clear virological and immunological benefit for the host, and more importantly, in study aimed to testing curative intervention is necessary to match as much as possible based on pre-ART initiation parameter. So with this, I would like to thank my mentor, Mirko Paiardini, and all the member of the lab, especially Emery Ryan, that she conducted the study with me. I want to thank all the folks at Emory University and all our outstanding collaborators from the NIH, NCI, University of Montreal, Institut Pasteur, the Oregon National Primate Research Center, and Case Western. I would like to thank the Gilead, Merck, and Janssen for providing the antiretroviral drugs, and also all our support for financing this study.